All right, I have my MAR here for Ellen Davis, date of birth 9/19/1965, MRN 00258. No known drug allergy. She's going to be getting furosemide 20 milligrams IVP as needed. For weight gains greater than 3 pounds in a 24-hour period or symptoms of fluid overload, this be given over a 2-minute span. We're also going to flush with 3 mLs normal saline before and after administration. So first we're going to do a little hand hygiene. We're going to get our medication together. So I have furosemide here. Expiration date is for 2031, and I also have my 2 saline flushes here. We should be getting 3 ml before and after. Expiration date for both are 6/2025. So let's go ahead and get our saline ready here. So first one, these are going to be 3 mLs. So this is a 10 ml saline syringe of. So we're going to be getting rid of 7 mLs of normal saline. There's our 3 mLs of normal saline for our first flush. And then I'm going to do the same thing again for our second flush. Again, this is a 10 ml, so we need to get it down to 3. So I'm going to get rid of 7 mLs of normal saline. And that's our second one. Next, I have furosemide, 100 milligrams in a 10 ml vial. She's going to be getting 20 milligrams IVP. Be given over a span of 2 minutes. So a little bit of med math. She's going to be getting 2 mLs of normal saline for her administration. So again, expiration date 4/3/2031. I'm going to scrub the hub vigorously for 15 seconds. I was good with that. I'm going to grab my 3 ml syringe that I have. I've got a 20 gauge 1-inch needle here to help draw up, so maintaining aseptic technique. Go ahead, I'm going to connect that. I'm going to withdraw 2 mLs of air. Inject that into the vial. Withdraw my 2 mLs of furosemide, which will equal out to 20 milligrams. Make sure all the air is out of there. It's my 20. I'm going to make sure it is labeled. I have 20 milligrams. Furosemide expires 4/2031, 20 milligrams IVP with med math compared to the vial. 100 milligrams, 10 ml is going to be 2 mLs. So keep that there. So next we're all set. We're going to go ahead. We're going to give a little bit of privacy and go in and talk to the patient. May I have your name and date of birth? Ellen Davis, 9/19/1965, MRN 00258, which matches up on her wristband there. All right. So, ma'am, what you're going to be getting today is a medication called furosemide. So, what that is it's a diuretic. It is pretty much, it's going to find any kind of excessive fluid that is in your body, and it's going to excrete it. So, one way it's going to excrete it is through urination. So, this medication does make you urinate a lot more than usual. So please let us know when you have to go. All right, so I'm going to palpate the area. No sign of infiltration, no sign of redness, swelling, no phlebitis. Any pain at the site? No. Good. So I have your furosemide 20 milligrams, 2 mLs, your 2 normal saline flushes at 3 mLs before and after. So I'm going to go ahead, I'm going to unclamp her site. I'm going to go ahead and I'm going to grab an alcohol swab, and I'm going to clean site vigorously for 15 seconds. And there's 15 seconds, so I'm going to grab my first flush. I'm going to take my first flush. I'm going to aspirate to see if there's any blood return. which there is. So good IV site there. So I'm just going to flush that with 3 mLs of normal saline. Discard my first one. I'm going to grab another alcohol swab. I'm going to vigorously scrub for 15 seconds. And again, you're getting 20 milligrams of furosemide IVP over 2 minutes. We have the right patient, right medication. We've double checked, triple checked. There's my 15 seconds of scrubbing. So I'm going to take the needle off of my furosemide. So I have furosemide 20 milligrams, expiration date for 2031. So I'm going to administer this over the span of 2 minutes. There's 30 seconds and I'm at 1.5 mLs. There's 1 minute and I'm at 1 ml left. Again, if you have to urinate, please let us know. Use the call bell to get a hold of us. There's 1.5 minutes and I am at 0.5 ml left. And there's 2 minutes and I'm just about done. There we go. So I'm going to go ahead and dispose of that in my sharps. Grab another alcohol swab. Go ahead and scrub this again for 15 seconds vigorously. Alright. I'm going to take my last saline here, 3 ml normal saline, so I can flush the site. I'm going to go ahead and we're going to flush that. And we're all set there. And lastly, I'm just going to take any palpitation, feel for any kind of swelling, infiltration, no sign of redness, any pain at all, no pain. Good. All right, so let me know if you have any questions, concerns, Ms. Davis. Again, this will tend to make you urinate a little bit more, so please let us know. Lastly, what I will do is clean up, go document what I have done as well.